line.
Yeah, let's do
Rothman Orthopaedics. We love Roth. Back out of whack, right? They got a doctor for every body part.
Neck.
Yes. I mean, you name it.
You.
All right. Now let's go to Dr. Emper, who is shoulder. Doc, do me a favor. Scooch over just a little bit so we see your handsome face. There you go, Doc.
Okay.
What do you say, pal?
How are you doing, Anthony? Nice to see you.
Great to see you. I'm fascinated. I love talking to you guys each week. The brilliance of really, we talk about athleticism and we talk about from professional athletes to weekend warriors like us who just want to get out there and are dealing with all kinds of aches, pains, knees, shoulders like you. And you keep us moving. And for that, eternally grateful. Let's talk about the shoulder, right? And let's talk about from a quarterback standpoint and some of the injuries that you could suffer shoulder from the quarterback spot.
So I do see a lot of label tears because I take care of Villanova and I have the opportunity to take care of a football team where you see the players from anywhere from 1 to 5 or 6 years nowadays. So you can see the progression of injuries. And I see a lot of label tears. Contact sports have a high incidence of label tears. It can either be driven into the turf or, just being slammed to the ground, or it can be your arm can be pulled back. If you're in a throwing position, it's your throwing arm. You get pulled back like that. If you're a D lineman and you're stretched out going to make a tackle, or if you're an offensive lineman and you kind of get your hands outside of your body and you get pushed back, you can dislocate your shoulder or partially dislocate your shoulder, which is called a subluxation, and that can cause a tear of the labrum.
Let me actually, I'm thankful that we're talking to you today about this. So, in fact, last night, my little one's a quarterback. He's 11, comes off the field, and he's like, Daddy, my shoulder hurts. And I said, where's it hurt? And he said, just below the shoulder, right? And we talked about warming up just from the throwing standpoint. Because they had him throw it like he was throwing deep. I'm like, dude, you got to throw before you got to warm your arm, especially for football, before you're trying to throw 40-yard passes. What's the appropriate to take care of the shoulder? What's the best way to do that?
So, I mean, it's a combination of strengthening and flexibility, like we've learned forever, when we were growing up. Work on your flexibility because especially if you're a throwing athlete, either a quarterback or particularly a pitcher, you tend to lose a little bit of internal rotation, which predisposes you to injury. So you got to do these particular stretches that therapists and trainers work with the kids with, particularly pitchers, a sleeper stretch they call it. And that's important to prevent the labral injury. Same thing with a strengthening program.
Yeah, it's interesting. We talk about that sort of thing. About preventative and how much, and you guys fix it, but preventative comes into play so much when we're talking about, shoulders and elbows, especially from a pitching standpoint.
Yeah, if you're a throwing athlete and you're a pitcher or you're a quarterback, there's a chance you're going to have some shoulder discomfort from time to time. Hopefully it's just a sprain, but labral tears occur in the shoulder. It's a joint where all of the stability of the joint is because of the ligaments. It's not like a ball and socket joint like the hip. So you got to strengthen your shoulder to help maintain those ligaments so they don't tear. If you tear your labrum, and that can happen, like I said, with a dislocation.
Yeah.
And 90% of the time, if you're a young kid playing sports, then you're probably going to have a labral tear and have trouble throwing. So
how long, typically, if you look at the different shoulder injuries, how long are we talking about? If you're talking about a labrum tear, what's the timetable for something like that?
So it depends on the extent of the tear. If you have a non-displaced small tear, it can scar down and heal up on its own, but it's going to take months. It's not going to scar down in a couple of weeks. And that's the more common thing is if you have a labral tear from a dislocation and you have an unstable shoulder, it's not going to heal well and it's going to keep tearing. So we're much more aggressive with repairing labral tears nowadays especially in contact athletes or throwing athletes, in order to restore them to that level that they want to be able to play.
How come pitchers, like, so when we talk about coming back from major surgery, that sort of thing, they'll actually get velo, like or is it psychosomatic where they think they're getting velocity increase, or is it just because they're healed, then that's what happens, that organically they'll have the extension to give you the higher velocity?
I think if you work on your flexibility, like I said, for to make sure you don't lose your internal rotation, and if you had a shoulder, you have a young athlete that was a little loose and it's tightened up, they can generate more like kinetic energy. It's just like with the elbow, with the Tommy John procedure, you get a more stable elbow, you're going to be able to generate more velocity. So I don't think it's psychosomatic. I think it can be real.
That's Doc, it's fascinating. Have you become a fan? I know you're from Harvard, right? You went to Harvard.
Yes.
Did you grow up in that area? Did you grow up in Boston?
I grew up in Wallingford, Delaware County.
I love it. I heard your accent. I go, man, you know what? I don't think he's from up there. I'm just curious. You have a great Delaware County accent, man. I love it. God bless you, man.
When I first went up there, thank you. When I first went up there and I met one of my friends from the football team, he was from like South Boston with the accent. I couldn't even understand him. Did not understand what wicked and all that stuff meant. And I finally, came to understand my Boston friends. But yeah, I went up there, played defensive back for 4 years, and went to med school there, and then came back to this area and been fortunate enough to work at Villanova. But yeah, I grew up in Delaware County. I went to Nether Providence, played 3 sports, just like we all did back in the day then.
I'm so proud of you. I love people from our area that are accomplished, that do big things, and God bless you, man. And I love the fact that you came home and wanted to make our region your area. It's one of the reasons why I'm so bullish on Rothman Orthopaedics and what you guys do there. So thanks. And brother, you're a testimony, Doc, to our area. God bless you, buddy.
Thank you. Appreciate it, Anthony. Thank you.
Go Birds. You don't like Dallas, right?
Yeah, I grew up taking my kids to the 600 level at the vet, teaching them how to share the concourse level with the 700 level and not get in trouble. That was like a three.
That's awesome.
That was like a 3-year. Yeah, that was like a 3-year PhD program. So
I love it. Dallas sucks. I love it.
Yeah,
that's
my favorite game. That was my favorite game, a Monday night game. The Reggie White, sack Troy Aikman 8 times. Love that. Love that.
Oh, that's awesome, man. Oh, this is the best. You're terrific, Doc. Thank you so much.
Thank you.
You're the best.
Thanks for having me on. I appreciate it.
What a pleasure. Dr. William Emper.